All right. Good morning, everybody. Jonathan Nez here, President of the Navajo Nation. Yate pen do that so kizigi do that hinashligi COVID-19 nahni chosto itini kudo banda huilne. The mo na atle honet na kijin da annashana. Aro dana eita don da annashtande Columbus Day no do tashi bakagish kiji. Um, Indigenous Peoples Day will yego eila a con a da illa le kin llande do are a hot is lean do hos do so la she hot dan hina jo kuichi be kagish kiji da ni linia a con de a hagi shi ba a dana an le jo la she do a kagish kiji de nedo beda hazan da jo hot that ni tina asa is ni do chianda da hanni hoda do kon hi keni hin da chagi da do yo da de inigi ya hota ban da hanni ho hota asa da hazlin li shladin ha hot zo ya United States hota shi Indigenous Peoples Day ada alia aro the more yajin da Asian tunnest is the at the naya a parade as lean do tashita hina even that do yat do here ade and has chindo ni aid and lini kistan linigida little tata seat lean baja jodi nasnigi e ashon ya kon John di nas ni even in na ekodo hanet ni het undel I ad mon atle hana so het ashi o he do alchindo alchine di zeigi banda at sehia measles mumps rubella da egi nas ni polio da juk COVID-19 ado monkeypox da ha no da yilni hilya na nas ni jo zegi bikije na anneshigi zel ende be da halno so alchindo jo da oltra de do ncha da sishi dan hit ni alchindo okuda bit nihle jo na tsosta bakao eben na che da oltra edo ni jo ba de ni ke che no lini edo ncha alchin vaccines immunization Belnenigia to Edo Kodona Kalchin Bada at Segido Eshido Anidigi da Doslish Kenoslini Ultrae Andalia Baja so Eshi 1,000 or left or Dido monkeypox at Nenigi at Nilia Ishni Kadadze Asa Ndez D.A. Kun Nihikeni Hine that there was not monkeypox. So ahota ato doi that the what the dinas nigi monkeypox igi. So di nihimas to that inigi ado nihila be that agi hand sanitizers that egi. To just to it ini nicht said nihila be that kla di hand sanitizers that agi. Da kun da ni the nebike up cow. So that no no shin hitch had a dot neck of the Tagahot Zand or here the shne Lego to the shah Hina Nishitasa Njonago Ekodo Nihina Nish B Bikich and De Baha Dailia and so on. So occasionally Washington the double Ghana that eggy Nakada Hani Hoda le de ne ko be master da yos idon lego tada de ka da no da yada ti she kodo ni hel ne hoda di na che kunashi ya yashti oda na che kunashi Đấy đã nó đồ đi bze do bitchin hikes ti ot khadaga ta da no ni do ot erjo di ni hik ni hinne pictures da no ot a e ya na se kun del I aro ya del ti o do ot a na se kun del I shike no leni e on thousand dollars da shi got a ni na ani do nda ili aro kun do zel endan lenigi Dr. Jill Jim Navajo Department of Health has AJ Aro stoit ini del kragi na tos kadel inigi nomination Epidemiology Department Del Yazi Eshi do hanen hije kode leto lef Aro aixa shahot zoja Navajo area Niki shahot zoja Kuro Dr. Kevin Gaines hanen hije kui leto lef Dr. Fowler ya do babi got the DJ so even that ashin hie kudo trat da huil net do lef a konden lashin dan hi natigi bilaganik ein hi bed hazen kudon hi masan hi chain hi nelishi which I ashtan dal ido le ba atqa da halne ashwade a do eishi bid nach ein antin kudo hi chikode net do le DJ a hiela good morning to everybody that's on the call. We have people from all over the Navajo Nation and beyond. And we have many viewers on the call. We continue to keep you updated on what's happening here on the Navajo Nation with COVID-19 and monkeypox. Let's start off with monkeypox. A month ago we announced 4 confirmed cases on Navajo. That's still the same. It hasn't changed. So good job to everyone. The same protocols, right? Mask and hand sanitizers to fight germs. And so we're coming upon flu season and a lot of allergies too, allergy season, right? And so, just be careful if you feel allergies, just get tested just to be on the safe side. There's home tests that are available. And vaccinations are important too as well. I was just told by our healthcare professionals that some of our children, our students out there, haven't got their updates on their immunization. Measles, mumps, rubella vaccinations, polio vaccination, and many others. You need to show those too at the schools. And let's get updated. Let's get your children updated. I know we've been focusing on COVID-19 for some time, getting those vaccines, and we thank you for that. For COVID-19, the positivity rate has just kind of flattened out a bit. I know it's low, but it's been low for some time, 9 to 12% positivity rate. And just stay the course. Of course, it's getting cold now too. We're going to be going back indoors where people are. So just be cognizant of that. Wear your mask. Get those hand sanitizers out. The Omicron boosters are available now. So when you get to one of the healthcare facilities, when you get your COVID-19 booster, you can also get your flu shot, the influenza shots as well. And that way you're protected, you got the armor. And also we got medium level of hospital admittance. So people going into the hospital, still people going in. So we just got to stay the course. I know we had fair season and parades. As you can see, I got a good tan from Tuba City Western Agency. It was pretty bright, and just stay the course. Continue to follow these protocols. I know I mentioned that we're going to slowly take off the restrictions, and Dr. Jim will talk a little bit about that today. Outdoor mask usage will go away. Of course, because of winter, indoor will stay for some time. But again, these public health professionals here help guide those decisions for the Navajo people. And we have Dr. Gaines from IHS here today. We got Navajo Nation Department of Health, the Epidemiology Department from the Navajo Nation, Dr. Jill, Jim, and Del Yazi. And so we bring this information to you so you can share it with your family members. Now that the fair, Navajo Nation fair and parade season is complete, we're going to transition now to the holidays, and there's going to be a lot more messaging, right? Because we're going to be wanting to come together for Halloween, Thanksgiving, Christmas, New Year's. And just as we have said these past couple of years, we don't want to see a spike. And we've seen a spike, right? These past couple of years from the holiday season. And so, stay the course. Stay the course. And yesterday was Indigenous Peoples Day. Of course, for us, every day is Indigenous Peoples Day. But we shared our culture, our tradition, our ways, our language, and hopefully teach those that don't know about Navajo or Native Americans a little bit more yesterday, and our contributions, our great contributions to this country, to the world, really. As you know, Navajo Code Talkers, right? Helped win battles, helped win World War II. But if you really step back and think about it, the Code Talkers and our veterans also helped spread democracy all over the world, all over the world. And let's not forget the uranium legacy too, all that uranium that was taken out of our lands that was used for bombs and weapons. And today we still have open uranium mines, and we're still advocating for compensation to our mine workers post 71, and also making sure that some of these cancers are covered so that they can get compensation. But those are things that we shared with many people yesterday, and hopefully they learned a little bit more about Navajo and the indigenous community. So take care of yourself. God bless you. And we will see you next week for the town hall every Tuesdays at 10 a.m. Let me turn the time over to our executive director, Dr. Jill Jim, give you more of an update. God bless you. Take care. Thank you.
Thank you, President, for all your efforts and continuing to do this, not only for always just keeping health as a priority for the Navajo people. Nishi, ashi na ke dona wacha kwa ati the kosin sagi na state that any by a day dog a day that anishi at the honestly although on the case so she so with art what John he lot conduct is that the don he cheat on his dad get that skit or ata na sinchi what been na han dates the higgy by a day skit like the creature she what at the jodi the cost quite the cold season honey non flu season that any gishi but quite is that the holoni she a been that quite is that chatash that they non hot that do chinya she to that to see koshi quite a wet and lanido on the old culture bonus checks on any she been that quite the Allan hada quite equishi band that so I'll talk to quite the public health nurses, other nurses and staffing, pediatricians that any have your shots up to date on any a check a big a COVID or that any Asian fish quite quite at any need or she been yeah on his quite but scout they needs and the sheep been yet though. A lot of those are to prevent certain diseases, but not just no. and the shin quality na kina kishin dojo quality ni halchin as the ingo bekne ketan net to get their wellness checks done. So we don't want any sort of new outbreaks of any different diseases or viruses. She been not in quality halchin appointment and get them all up to date as well. Adoshin Adoshin quality into the flu season, and now we have a booster dose too, a bivalent vaccine, and most facilities should have those available for everyone now that are eligible for that. So making sure you talk to your physician or looking at the CDC guidelines on when you're eligible for your vaccine or booster dose. So there are guidelines in place. Just make sure if you have questions to contact your provider or physician to ask those questions as well. And I know that their kids are all back in school too. And I think we want them to be going to school. There has been no reports of any outbreaks so far, so I know our schools are doing a good job requiring the vaccine. Not requiring the vaccine, sorry, mask mandates indoors. And so everyone should be complying with that as we're convening and going into the next phase of the pandemic. It's really important. Some of these restrictions, we will put those upon you as citizens to make those decisions. And on the in this last surge, I used to think, oh, so I think and hit the how long she day of it she the skinny kahagi iso a day news and I think look at his thousand those in the shin quality are such a quality restriction to the indoor. So it is going to be up to us to make those decisions to gather safely for the holidays. And such on quality what's on genomic how to safely gather. Some families maybe really be careful making sure if your people are traveling off out of the reservation back on to check for if they're making sure they have no symptoms and making sure you stay home when you're sick. Although Halloween is coming up and there's going to be schools that are going to be gathering and classroom parties and all of those apply. These are things that we learned for the last 2 or so years on how to address COVID. We are still seeing people getting sick, and it's not completely over. And I think that's the message that we have. It's still a very high public health concern that we don't get a lot of people have people get sick. So just making sure that you take into considerations that. And then with that said, and I think some of the restrictions I know will be lifting some of these, and I know indoor masking will still be a priority, especially during this season. And we don't know what is in the future. We can't predict that, but we know that as people come indoors, they will gather more indoors, and we just want to make sure people are safe. And so that for that reason, I think it's important to get all your vaccines up to date, and also taking all the precautions that you have learned and practiced for a long time. And it should be part of our daily habit now to do that. And also when you're out in the border town areas too, to take that into consideration as well. So I just want to message that out, and hopefully we'll have new public health emergency orders in the next couple of weeks. But we know that the COVID-19 safety practices are very general and do apply to everyone. So if you're a business or a school, some of those recommendations are very important. So go onto the Navajo Department of Health webpage and review those and share them and practice it as well. So wash your hands, mask up, and watch your distance as well. So With that said, I think I'm going to go ahead and give it over to Dr. Kevin Gaines. He's the Chief Medical Officer for the Navajo Area Indian Health Service and also a valuable member of our Health Command Operations Center. We are still in a public health emergency, as far as I know, that has not been lifted. So we're thankful that these town halls continue and for the health professionals to come together and continue to remind us on how to keep each other and ourselves safe. So take it away, Dr. Gaines.
Good morning, everybody. So just a couple of things to add to what's already been said. One is our facilities across the area are providing, for the most part, the same routine and elective services they were providing prior to COVID. So hopefully beginning to get access back to routine primary care and other services that are needed. Certainly, we'll continue to monitor with everybody else the status of COVID and other potential threats, and we'll adjust if and when needed down the road. And as has been mentioned, with school being in session, the cold weather and people gathering indoors, and the upcoming holidays and family gatherings, the best protection is your immunizations, and that's true for flu and COVID. And especially for our school-age children, the routine childhood immunizations that were mentioned that help protect against measles and chickenpox and polio and other diseases. Those immunization rates have dropped off a little bit over the last 2.5 years due to all the resources being focused on COVID, but we are attempting to get back and get everything updated. So we encourage anyone with children in the home to um, check in with your primary providers and make sure that they're updated on all their immunizations as well. And just one last thing, if you visit any of our clinics or hospitals, we still do have mask mandates in all the facilities, and that's primarily to protect our most vulnerable patients. Day in and day out in the clinics and hospital, we have cancer patients and other compromised people coming in and out of our doors all day, every day. And we want to do the best we can to protect them against being exposed while they're there. So if you visit one of our clinics, expect to be required to wear a mask. That's all I have. Thank you.
Well, thank you, Dr. Gaines, for that. A simple reminder, I think, with what President and I mentioned. Del, do you want to go ahead and go over the gating measures for the Navajo Nation regarding COVID? Thank you.
Yes, thank you, Dr. Jim. Hi, everyone. My name is Del with the Epicenter and also our COVID Epi team, providing the latest numbers here. Navajo Nation COVID-19 Nashni Nalka time period September 30th through October 6th. First, I want to acknowledge our Epi team. For COVID, we have a large epidemiology team conducting our COVID-19 disease surveillance on the nation from our own Navajo Epicenter, Navajo Department of Health, IHS, Navajo Area IHS, the Tribal Health Organizations, 638 facilities, some people from CDC, CDC Foundation, Johns Hopkins Center for Indigenous Health, COPE, and then the COVID strain surveillance with our partnership with TGen, Translational Genomics, and of course our state health departments from Arizona, New Mexico, and Utah. So a large epi team compiling all the data every day. So just wanted to acknowledge them and thank them. So recent cases and trends, this is a 60-day time window, our 7-day moving average here. You can see the blue bars go up and down. That's our daily case counts, do vary quite a bit every day. But the orange line is our 7-day moving average, gives you a better sense of the trend. And since about early August to now, we've been on this downward trend of COVID cases. So good sign. Some core metrics here are 7-day COVID-19 case rate is now at 120 cases per 100,000 people. This continues to decrease. Percent staff beds occupied by COVID patients remains at 2.3%, which is medium risk. And then our hospital admission rate is at 0.65 per 100,000 people, still at medium risk. Supplemental metrics. There were 190 new cases over a 7-day period, which is a minus 47% change from last week. So that's a really good sign that the numbers continue to decrease. 7-day lab-based test positivity is at 11.7%, roughly about the same as last week. Hospital capacity for bed occupancy for regular beds is at 50%, and then ICU beds is at 59%. So below our 80% threshold. So this is also holding steady. Vaccine coverage. Those who have completed the primary series is at 69.6%. And then those are up to date with the new definition is at 6.7%. And as you all know, or some of you may not know, the new definition for up to date is getting the new bivalent COVID booster, which is the Omicron BA4, BA5 bivalent booster. So we encourage everyone to get that booster. And that's the latest definition for being up to date in your vaccination for COVID-19. Navajo Nation COVID strain surveillance is ongoing with TGen. The Omicron sublineages, for the most part, have all been identified on the nation. I'll go over that here more in detail in a little bit. 130,189 Navajo Nation residents have completed the primary series. 12,522 are up to date with the COVID bivalent booster. And then the epi curves for the entire pandemic. The blue is the US and the orange is Navajo Nation. Over here on the far right, we're both on the Navajo Nation and across the US on a downward trend as far as the number of COVID cases. 7-day case rates here, comparing Navajo Nation here in the yellow bar to the 50 states. And the red bars here are the four corners, our neighboring states, New Mexico, Colorado, Utah, and Arizona. And we were number 1 last week, and now we're at number 12. So we did go down a bit. So again, good sign. Across the country, 7-day case rates here. Within our region, just Colorado and New Mexico, with a little bit of a higher number of cases compared to Utah and Arizona. Community transmission across the country, still a lot of red and orange and yellow. So within our region, Coconino, Navajo, Apache counties are all red on the Arizona side. McKinley and San Juan counties in New Mexico are red as well. And then in Utah, the San Juan county is red, meaning high COVID community transmission. Latest COVID strain surveillance here. This was updated last Wednesday. So the only highlight here is really the BA5 sublineage here continues to be the predominant, currently the predominant variant on the nation. As you can see here, all facilities continue to participate in this strain surveillance. And then the bottom chart here is the BA5, as I mentioned, as the predominant variant across the Navajo Nation. And then across the US, the CDC variant profile, also the BA5 is the predominant variant still at almost 80% of the cases are the BA5 Omicron sublineage. And last, COVID high transmission chapters. This time around, there are 29 chapters that made the list here in the green column. And then if you go across to the right, going back in time, all the way to going back about 6 weeks, these 11 chapters have been on this list every week for at least 6 weeks. So, and that's my last slide. So I'm gonna stop here, and not sure. I'm gonna hand it back over to President or Dr. Jim, or I could be the last presenter.
Yeah, thank you, Del, for the information and as well. So I would just want to reiterate that today's message is just to get everyone to realize that we are still wanting to make sure that we get vaccines updated for kids and for adults, especially our elders, for our bivalent vaccine boosters as well. There is a slow uptake of getting vaccines nationally for COVID because we don't know. We know that the BA.4 and BA.5 are currently on the reservation, but we also know that new variants are always a threat and are being monitored. So I think there's always going to be an ongoing subvariant or new variant of Omicron or other variants that we're going to see until we see a diminishing, very low cases. I think we're just as part of the norm now, and I think part of that is just making sure that we get vaccinated and also take the precautions that we need to. I know that the indoor mask mandate is going to be very important. Not a lot of states or federal agencies are requiring that, but here on the Navajo Nation, we're still going to support that. And I think we've gotten used to it as well. And it's not more of it's our own choice to do this. But when we're in public, we need to be careful. We're not, if you are recovering from COVID, the isolation and quarantine guidelines, there's no more quarantine, there's isolation. But after 5 to 10 days, if there's no symptoms, you can be out and about. And so that's when masking is going to be very important. So when you have symptoms and you're out there and you don't have a fever, but you need to still make an errand. If you don't have a plan in place, it's very important to still follow all of these recommendations to keep everyone safe and not spread COVID very quickly. We know that COVID is easily transmittable. And so just being careful out there is going to be very important, especially for our elders. So making sure we still protect our elders, and they're the most vulnerable and those with health conditions too. And we want everyone to celebrate safely. And it was very exciting to see people out there in the community in the To the City agency fair. And also during the Navajo Nation fair, everyone's excited to come out and be around our relatives again. But it's always important to always monitor yourself. And I think it's always important to just realize that the most important thing right now that I think with the Western Fair agencies, I mean, most likely you'll start to see symptoms 2 to 3 days afterwards. So don't mistake it for a cold or an allergy or other things and get tested. A PCR test. Home test kits are also still available through the CHR offices as well. So if you need a COVID test kit, facilities and CHR offices have that available as well. So just being mindful of that as well. There is accessibility. Our 928-871-7014 number is still available at the Health Command Center. We are still issuing out isolation kits for those in warmer areas to the end of the month. So just to know there are still some resources available for those that need help. But with that said, if President's not going to get on the line again, I think that's just a quick summary of our COVID situation here. We are not going up, which is good. We want to continue to go down, and just being careful is going to be our message. So, have a good day.